My name is Dr. David Forshaw. I'm a board-certified neurosurgeon. I'm a member of NOS, Neurosurgery, Orthopedic, and Spine Specialists. We treat patients in the community for going on 40 plus years here. What we do is we partner with certain hospitals to provide high-quality, compassionate local care, and St. Mary's is one of our partners. So lumbar spine surgery is one of the most common procedures we do as neurosurgeons. We specialize in the operative treatment of brain and spine pathology. The lumbar spine is the lowest part of the spine. It is people's low back. When people come to me with problems with their low back, it can manifest as back pain, leg pain, numbness, tingling, and weakness. Sometimes when patients fail conservative treatments, physical therapy, medications, injections, they need or want surgery. So we perform lumbar spine surgery with several goals in mind. One is to decrease pain, 2 is to increase function, 3 is to stabilize the spine, and 4 would be to deal with chronic low back pain. When someone has lumbar spine surgery, it's obviously a major life choice they're going into. And we like to have our patients understand what they're getting into both the day of surgery and then for the recovery afterwards. Patients have a variable recovery. The surgeries like a lumbar discectomy, they go home the same day with a small bandage on their back. They're up out of bed walking around the day of surgery. They're going to have some back pain, tightness and stiffness. We treat that with some muscle relaxants and maybe a little gentle narcotic. By about 4 to 6 weeks after surgery, patients are typically back to their preoperative activities. If someone has a lumbar spine fusion, that's a much more significant surgery with a longer recovery. The time course for that recovery is on the order of months. It'll be several months before they start feeling themselves again due to the trauma of surgery. They will be up out of bed walking around the day of surgery. They'll typically be in the hospital 1, possibly 2 days afterwards. Then for the first 4 to 6 weeks, they're participating in outpatient physical therapy, and then we gradually get a return to function over the next several months. It can take 6 months to a year for the bones to fully heal before we can give them the all clear to resume their full and normal activities. We like to do our surgeries at St. Mary's Hospital because, one, they're in the community. We like to give patients care close to home so their families can visit them and they can continue to have well-structured follow-up with their clinical team. We have spent time cultivating relationships with the nursing staff, the anesthesia team, the medical team. What that means for the patient is that there is a very fluid, comprehensive, and thoughtful approach to taking care of them from the time they start their journey in our office through the preoperative period, the hospital stay, and their recovery. The other reason we work with St. Mary's Hospital is because they're in the forefront of bringing in modern technologies. What this allows us to do is provide patients with cutting-edge services to both make their surgeries get safer, more efficiently, for faster recoveries. So we have worked with St. Mary's Hospital very closely over the years in order to get external markers of our excellence. Some of these have been through the Joint Commission Accreditation for Spine Surgery, another which is the Blue Cross Insurance Company's Center of Distinction. So outside, independent, third parties have verified the hard work we do in order to assure that our patients get the best possible care here in the community.